So where are we in terms of workforce? We have a crisis in workforce in this country. We still operate as feudal crafts. I must say, when I was younger, I thought by the time I got to be this age, these feudal crafts would be at least not dissolved, but at least the lines between them would be blurred. I'm not convinced that that's happening. So what you do depends on what craft card you carry and what state you live in. And it doesn't make sense. I don't think medical home is the same thing as primary care. And I don't think accountable care organizations have anything necessarily to do with the quality of care or what else is going on. Someone said this is what we have. So we have to engage in sabotage. We have to take these words and make them ours, because we know what we want these to mean. They're using the same language as semantics. We have to take ownership of them and make them do what we know is necessary. Workforce issues are not simply a question of shortages. We have shortages of primary care. Most people in the country believe we do not have anywhere near the primary care providers of any type to meet the increased need in health reform half works. And most people locally don't believe we have this capacity in our area, even though we're relatively rich in terms of health providers. One of the things our department will be doing with the City Department of Health over the next several months is actually trying in a sort of scientific way to look at that and try to make estimates on what is the primary care capacity in Cook County, where are the holes, and so we have a grant from the trust to look at that. So it's not just a question of not having enough people, and by the way, there are certain specialties that we really don't have enough of either. It also is a question of maldistribution, both in terms of who we're training and how we're training them and where they practice. So it doesn't do you any good to sit in the heart of the West Side Medical Center and not be able to get a hip replacement for 5 years because we, as a system, can't afford the prosthesis. So we have some problems. We used to get our orthopedic surgeon time donated. I think Jorge is still donating his time. But if we can't give him the plastic hip to put in the patient, you're in trouble. What we're talking about is a fundamental transformation of our medical care system into a healthcare system. That's what we need. If we don't do that, we will not be efficient and we will not save money. It's not going to happen. This act, the way it's laid out, does not guarantee that. People in this audience have to guarantee that. This approach has to be based on not whether your dish payment is going to go down or how you could juggle your customer service. All those things are important. It has to be based on the concept that healthcare is a human right. We need to invest in the workforce, the equivalent in 2010 dollars, what $500 million was 100 years ago. You all know that I'm a single payer advocate. Mr. Foley is in charge of my malpractice insurance. And I would be remiss if I didn't stand up here and tell you, as a practicing physician and a public health expert, the stuff we passed will not work. It's not a question of preference or what we prefer to have. It will not accomplish what its makers wanted it to accomplish. And the question that we have in this room, and what everybody's been talking about, is first, how do we make sure that the safety net doesn't get destroyed in the process of trying to fix this monstrosity? Because that's a real danger. It's a danger for county. It's a danger for the FQHCs. It's a danger for the community health centers. They think they have trouble recruiting primary care doctors now. Wait until everybody's trying to recruit us. The second question is, how after 200 years, at least 150, let me not be too big, of trying to get this country to function sort of close to the rest of the world in terms of providing medical care and health care to its population, How do we guarantee that that happens before all of us are there? So let me stop there.